There's been so much time talking about COVID these days that we often overlook some of the more grievous diseases and other conditions that affect our world. Malaria among them, most common in sub-Saharan Africa. It kills thousands, mostly children, every single year. Now, for the first time ever, the World Health Organization is greenlighting a vaccine for that disease.
As some of you may know, I started my career as a malaria researcher, and I longed for the day that we would have an effective vaccine against this ancient and terrible disease. And today is that day, an historic day. Today, WHO is recommending the broad use of the world's first malaria vaccine.
Researchers estimate that that vaccine could prevent millions of cases, save tens of thousands of children's lives every year. Dr. Mary Hamel leads the World Health Organization's malaria vaccine implementation program, and she is in Geneva. Dr. Hamel, so good to have you on the program. And I know for much of the world, the past year and a half, when we've talked about vaccines, we've been talking about COVID. But of course, malaria has long been a killer, particularly in sub-Saharan Africa. What does this mean, the idea of just having a vaccine? How big is it?
Yeah, well, David, you've probably heard that it's historic, and it really is a historic moment. We've been searching for a malaria vaccine for over 60 years. It's been very elusive, very difficult to find a malaria vaccine. And now, for the first time, we have one that can be delivered, that can be given to children, that can reach them in high coverage. So it's an exciting moment in science, but more importantly, it's a very important moment in child health.
We don't see malaria up close in many Western countries. You, however, of course, have studied this for 25 years and have lived in Africa. Can you just give us a sense of what it is like to see it, a disease that strikes children particularly?
Yeah, it is a very tragic disease. The onset of symptoms is just a fever. You know, if you're a parent, your child has probably had a number of fevers, but it rapidly progresses, and often it progresses so quickly that parents don't have a chance to intervene. So first, child is a little bit sick. Very quickly, it could go to shaking, chills, deteriorate into convulsions. The child becomes very pale as their blood cells are burst by the parasite itself. And then, as you know, your red blood cells carry oxygen to your vital organs, so they start breathing very heavily as their little bodies try to get the blood cells to their vital organs, deliver oxygen. And then they can go quickly into delirium and sadly coma and death. And this happens in a matter of hours. Average time from first fever to death is 24 to 48 hours. And this is why prevention is so critically important.
So let's talk about that prevention by way of this vaccine. It's called, and I hope I'm pronouncing it correctly, Mosquirix?
Mosquirix, that's right.
Mosquirix, okay, so like mosquito, but with the rix that you often hear in vaccines. It has sort of modest efficacy, prevents about 30% of severe malaria cases. You know, how useful will it be in this battle?
Yeah, it will be very useful. Okay. So I think people don't realize that malaria remains a major killer of children in the world. There are over 200 million cases of malaria each year and 400,000 deaths. And the vast majority of those are in Africa, and the majority of cases and deaths are in African children. And so if you can imagine a vaccine that reduces all malaria by 40%, like this one does over a 4-year period, and then substantially reduces life-threatening severe malaria, this can make major impact.
What are we to make, Dr. Hamel, that it took a year to develop multiple vaccines against COVID, and those vaccines were purchased en masse by wealthy nations, but it took decades to develop a vaccine against malaria, a disease that primarily affects poorer nations.
Well, I think there is a lot of discussion about this. I think we have to be very clear that a malaria parasite is a much more complex organism than a virus. The malaria parasite has 5,000 genes. It has life cycles that change in the human, and it has a life cycle period in the mosquito. So very complex. I think what you're getting at is the commitment and the funding, and that's very important. But this was a difficult vaccine to make, and this is potentially why we have the efficacy that we do for this vaccine, because of the complexity of the parasite itself.
Now, from the complexity of the,
I will.
Oh yeah, please go ahead.
I will say, though, that there are lessons to be learned, good lessons to be learned from this COVID vaccine development. And one of those is when you do have that kind of political will and commitment, you can bring a vaccine forward quickly, and you can scale it up so that supply is as much higher than one would expect it usually to be.
You speak about the complexity of the parasite and the challenges in developing a vaccine, and now, of course, there's the complexity of the logistics of delivering that vaccine. First of all, of manufacturing it in sufficient quantities and then getting it into arms, and particularly kids' arms, and hundreds of millions we're talking about. How does that work now?
Yeah, so I think the next challenges we're going to face are the funding to bring the vaccine to the children who serve to benefit from it. And this will require the global health funding bodies such as Gavi to consider if and how to invest in this vaccine to bring it forward. After that, there almost certainly will be supply challenges. We've seen it with the COVID vaccine. We'll see it with the malaria vaccine. We expect very high demand, and it takes time for manufacturers to build up their supply. So there will be a period of where demand outstrips supply.
We've only got seconds left with you, but after all of the years that you've spent in your career working on this, in your medical career, in your epidemiological career working on this, after the time you spent living in the areas that are most profoundly affected by this, as it became clear to you that a vaccine was about to be realized, what was going through your mind?
I think that this vaccine and the way it does reach children, 70, 80, 90% of children at risk receiving the vaccine, I think it's going to have tremendous impact as long as people continue using their insecticide-treated nets and other interventions. And that's going to save children's lives, make them healthier, and keep families intact. And that's really what we're celebrating this week.
Well, Dr. Hamel, absolutely a celebration ahead. Thank you so much for speaking with us.
Thank you. It's my pleasure.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.